Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina, professor of the University of School of Medicine, Buenos Aires, and ex-chief of plastic surgeon, Pena Hospital, and also an international recognition in non-invasive procedures. I developed a new technique like blepharoplasty without skin resection. It's a unique technique. Many patients come from outside or the countryside to perform different kinds of procedures. Someone come to a full face rejuvenation, endobrow, blepharoplasty without skin resection, facelift, carbon dioxide laser, and fillers. But the others come looking for a non-invasive procedure because this is not the time for the surgery for this kind of patient. And today I'm going to talk about a very interesting theme that is non-surgical facelift using ultrasound and fillers, hyaluronic fillers. And I think all people understand what does mean fillers, but few ones understand what mean facial rejuvenation with ultrasound. I have many videos talking about the use of ultrasound in facial rejuvenation. This is my curriculum. This patient come looking for non-invasive procedures, and you can see the eyebrow in good position over the orbital rim, have no upper and neither lower eyelid fat pads, but she had volumination, but not a volumination, beautiful voluminization of the zygomatic arch of the cheek. And I propose this patient toxin botulinum in this area in order to pull up the tail of the eyebrow, to perform fillers in this area, because the lower lid cheek junction is here. We have a cut here. If you go to see the importance in the cheek, in lower eyelid, you are going to understand the importance of the cheek in the lower eyelid aesthetic. Then at this patient, I suggest filler in this area and also fillers in the nasolabial sulcus and in this area. But the most important thing, this patient have a square face because have important ptosis, face ptosis, and this ptosis produce this bulging, and you can see no definition of the jawline. We can see the jawline because they have a lot of fat here and also ptosis. Here we can see clearly how folding the face under the jawline and the lack of definition of the jawline. And also this patient have lip wrinkles, lack of definition the cupid arch, lack definition of the pillars, and here all these wrinkles or sulcus is because have no hydration of the lips. And also this patient I propose the definition of the cupid arch, a volumination of the pillar, and hydration of the lips. Generally this patient don't look for a big lips, because generally the young patient look for big lips. All these patients said, "Doctor, I don't want a natural result. And all the time I said, I'm not going to give you natural result. I'm going to put the fillers that you can look natural and recovery what the aging process you lost. And here again you can see the lack of definition and also the retrusion of the chin. You trace a line from here to here, you can see the chin is very and for surgery we need to put a chin implant here, but this patient do not want, and I propose fillers here. The question is, I use ultrasound to liquid the fat in this, where is the here? Liquid the fat in this area, because if you use the ultrasound deep, you produce a fat liquation. It's not recommended in this area because if the patient lost volume in this area. If I use ultrasound here, I use in very superficial, only to tighten the collagen, not to denaturalize the fat, because when we age, we lose volume of the fat in the cheek area. In conclusion, I use ultrasound to liquid and to burn. You can see burn, evaporate, and denaturalize the deep fat, and also very superficial ultrasound to tighten the collagen. First, I need to use ultrasound and second fillers, because if I use first fillers and second ultrasound, I'm going to take out the fillers for the evaporation. Then I use a full face ultrasound, very superficial here, and very deep here to evaporate and denaturalize the fat. And after that, I perform fillers in the jawline. Here in the nasolabial sulcus, I use a lot in the chin. I use nearly 12 syringes of hyaluronic acid. You think it's a lot? No, it's not a lot, because it's only 1 cc by syringe, and I use here, and if you use in several areas, it's not a lot. Here is the patient sent me pictures just 1 week after the procedure. You can see here a little hematoma, but you can see the protrusion of the chin, and here you can see the lack of the chin, and you can see voluminization of the malar area. The lower cheek junction is here, and you can not see lower lid junction junction. You can see the lower lid and cheek is just like a unit. And if you look for internet and you put young patient, beautiful patient, you are going to see there is no lower lid cheek junction. It's like only just an onion here. Beautiful patient have a lot of volume in this area, in the zygomatic area, and all you can see the cheek area. The definition of the jawline, the definition of the neck, the definition of the nasolabial sulcus, the voluminization of the cheek. Here is a lack of voluminization. Lower lid cheek junction here, and you have no lower lid cheek junction here. And here is unbelievable this picture. You can see the beauty of the voluminization of the chin. This picture sent me the patient from her home. The definition, no definition here, square face here, lower cheek junction, no lower lip cheek junction. All these pictures come from the patient. Without lift. And this is after 4 months. I said, doctor, look like he's very happy with the result. You see the lips, you can see the definition of the pillar. The only problem here is last 14 months, 16 months. No pillars. No cupid arch. No hydration. A little of volume of the lips. That is a natural product, is hyaluronic acid. No lower lip junction, just 1 unit. And you can see in this picture the importance of the volume, concavity, depression, convection, concavity. The beauty of the lips. She was very afraid of the voluminization of the lip, like all my patients. Okay. I hope you enjoyed this presentation. Have a nice day.